first exercise that we're going to be doing today, it's called isometric scapular setting. So for this exercise, we want to tell the patient to lay down on the table. So we're going to pretend that the table is here. And we're going to have the patient's bad side up. So we're going to pretend that my right arm is the bad shoulder. So the doctor is going to contact the patient's lateral border of the scapula with one hand, and it's going to support the patient's bad arm with the other hand. Now we're going to tell the patient to push into the doctor's resistance and to hold that position. Remember that isometric exercises are usually held for 6 to 10 seconds, and it's important to remember that the patient should not be actively holding the arm up. The doctor is the one that should be holding the patient's arm. And then they're gonna, because it's an exercise, we want to tell them to brace and breathe at all times. The second exercise that we're gonna be doing today is called scapular setting. For this exercise, we want to remind the patient to brace and breathe, and we want to tell them to stand with their arms by their side. Now we're going to tell them to bring the scapulas down and back towards the opposite pant pocket in a diagonal direction. So the right scapula is going to go towards the left pant pocket, and the left scapula is going to go towards my right pant pocket. We're going to remind them to brace and breathe. And we also want to tell them that this is just small movements. We're going to be palpating the patient to ensure that there's muscle contraction, and the doctor can also be tapping or giving some strokes to increase that kinetic awareness on the patient. So it should look something like this. They're going to stand arms by their side, and then they're going to bring their scapulas down and back towards the opposite pocket. They're going to brace and breathe at all times, and then they're going to relax. The next exercise is called scapular setting with TheraBand. So for this exercise, we want to remind them to brace and breathe at all times. And we want to grab a TheraBand, and we're going to tell the patient to wrap it around the thumbs or their hands. And we're going to tell them that their shoulders should be on 150 degrees forward flexion. So about right here. And then we're going to tell the patient to do a scapular setting by bringing the scapulas together, down and back towards the opposite pant pocket. We want to remind them that the shoulders should not move, and the movement should only occur at their scapulas. So it should look something like this. They're going to hold it, they're going to brace and breathe, and then they're going to relax. The next exercise is called scapular setting with a ball. So what we're going to do is we're going to tell the patient to hold a ball at a 90-degree angle of forward flexion, so just like this. And we're going to tell them to set the scapula, like we already taught them how to do, bringing their scapulas together, down and back towards the opposite pocket. We're going to tell them to hold it there, and the doctor is going to perturbate either the ball or the patient's arm. We can do it in forward flexion of 90 degrees, or we can also do it in scapular plane, so right here, and set the scapula, and then relax, and remember that they should be bracing and breathing at all times. The next exercise is called scapular punch. For this exercise, we're going to tell the patient to lay down supine, and they're going to bring their shoulder at a 90-degree of forward flexion, and they're going to have the knees bent at a 90-degree angle as well. We're going to tell the patient to brace and breathe, and we're going to tell them to reach towards the ceiling with that arm without moving the shoulder, just by moving the scapula. So it should look something like this. And then they relax. They're going to do this bilaterally, and then relax. And then we can progress this exercise by adding a 1, 2, 3 hand weight to the exercise. Bracing and breathing, and then relaxing, and then bilaterally, and then relax. The next exercise is called scapular punch with TheraBand. We want to have the patient stand with the TheraBand wrapped around their back, and we want the arms, the shoulders to be at a 90-degree angle of forward flexion and the thumbs pointing up. We want to make sure that the TheraBand is at the level of the shoulders. So we don't want it too high or too low on their backs. Now we want to tell them to brace and breathe, and they're going to bring their arm forward just by moving the scapula, not the shoulder. So it should look something like this. They can do one arm at the same time, or they can do both scapulas at the same time. And then they're going to relax, they're bracing and breathing, and we can progress this exercise by stepping forward with the contralateral leg and doing the same thing with the other arm. So just having it at 90 degrees angle of forward flexion, and bringing it forward and then relaxing, and then bringing it forward and then relaxing. The next exercise is called door pulley passive range of motion. So for this exercise, we're going to use a pulley. In this case, this is going to simulate the pulley. And we're going to hook the pulley over a door. So we're going to pretend that here this is a door. And we have to make sure that the door is locked. So for this one, we can do forward flexion or we can do abduction. For the forward flexion, we want to make sure that the patient's back is towards the door. And we're going to pretend that my left arm is the good arm and my right arm is the bad arm. So we're going to use the left arm to cause the passive forward flexion on my right arm. So basically my right arm is not doing anything. Everything is coming from my left arm. So we're going to have the right arm right here, and we're going to make sure that the palm of the bad arm is facing down. So just like this. Now we're going to start pulling the pulley and causing that forward flexion while telling the patient to brace and breathe. And then we're going to do it again. Everything comes from the left arm. Good. Now to do abduction, we want to make sure that the good side is towards the door and the bad side is away from the door. So we don't want to be we want to be in the scapular, in the scaption. We want to be in scaption, so in the scapular plane. So we don't want to be right here. We want to be right here, and we want to make sure that the thumb is pointing up. So for this one, we want to use the left arm to pull and cause abduction in the scapular plane of the right arm. So it should look something like this. So they're going to be pulling, and they're going to be bracing and breathing. So they're not doing anything with the right arm. Everything comes from the left arm. And then they relax. Next exercise is called self-mobilization. We can do self-mobilization to increase external rotation, but also to increase forward flexion of the shoulder. So the first one that I'm going to be showing is self-mobilization to increase external rotation. So we're going to have the patient sitting with the arm resting on a table, and we want the patient's shoulder to be in the scapular plane with the elbow bent at 90 degrees and the palm is going to be facing down. Now you're going to tell the patient to brace and breathe and start bending at their waist like this. This is going to create that external rotation on the shoulder. Now to increase forward flexion, you're going to tell the patient to sit facing the table, and they're going to place their arm on the edge of the table. You can use a towel under the patient's arm to help with arm sliding, so just like this. So the bad arm is going to go on the edge of the table, and the elbow is going to be slightly flexed, and you're going to tell the patient to start by sliding the arm along the table while bending at the waist and maintaining an abdominal brace and breathing. So this is going to increase that forward flexion that the patient is lacking of. Okay, now we're going to do some shoulder stretches. The first stretch that we're going to be doing today is called sleeper stretch. This stretch is going to help the patient increase the internal rotation, but stretching the infraspinatus and the teres minor muscles, which are muscles that are in the back of the shoulder. So we're going to do the stretch for the left shoulder first. So for this, we're gonna ask the patient to lay down on their side, and they're gonna lay down on the lateral border of the scapula. Then they're gonna have the shoulder at a 45-degree of angle of forward flexion, and the elbow is gonna be bent at 90 degrees. Now you're gonna tell the patient to gently push the forearm towards the table by contacting proximal to the wrist, so right here. And they're gonna push toward the table. You wanna hold it, they wanna hold it for 15 to 30 seconds, and you wanna remind them that there should be no pain, just a light stretch. And then they can relax. And then we can progress this exercise by having them move the arm to a 90-degree angle of forward flexion, so from 45 to a 90-degree angle, and doing the same thing, and then pushing towards the table. There should not be any pain, just a light stretch, and they're gonna hold it for 15 to 30 seconds, and they should be feeling it in the back of the shoulder. Now we can also progress this exercise by leaning the body over towards the arm and doing the same thing. Start at 45-degree angle and then at a 90-degree angle. Now this exercise can also be done standing against the wall. The next thing that we're gonna do today is another stretch. This stretch is called doorway stretch. So this stretch is gonna be stretching the pec minor, so it should be felt right here. But it is contraindicated if a patient has anterior instability of the shoulder. So for this stretch, we're gonna tell the patient to have the arm up, horizontally abducted to 90 degrees, and have the elbow also have the elbow bent at a 90-degree angle too. Then you're gonna tell the patient to rest the forearm, so right here, rest the forearm against the doorway, and take a step forward with the leg that is closest to the doorway. Now you're gonna tell the patient to start rotating the trunk away from the side that is gonna be stretched right here, and hold that stretch. Remember that we wanna tell them that there should be no pain, just a light stretch, and they should hold this stretch for 15 to 30 seconds. And then they relax. Now we're gonna go back to the exercises. So we're gonna do some isometric exercises for the shoulder now. So first, we're gonna tell the patient that they're gonna be setting the scapula first. And remember that because we're doing isometric exercises, they're gonna be holding the exercise, each exercise for 6 to 10 seconds. So we're gonna do isometric exercises for forward flexion, extension, abduction, internal rotation, and external rotation. So for forward flexion, we're gonna tell them to set up the scapula, and then I'm gonna use my left hand to resist the motion of what my right arm is gonna be doing. So in this case, it's forward flexion, so set up the scapula, and then resist with the left arm, with the left hand, hold for 6 to 10 seconds, and bracing and breathing the whole time, and then relax. Now we're gonna do extension, so my right arm is gonna do extension, and my left hand is gonna resist. Hold for 6 to 10 seconds, bracing and breathing. And we're gonna do abduction, so we're gonna have it right here, and right arm is doing abduction, and left hand is resisting abduction, bracing and breathing, holding for 6 to 10 seconds. Now we're gonna do internal rotation. So right arm is doing internal rotation while the left hand is resisting the motion. They're bracing and breathing, and we're holding for 6 to 10 seconds. Now external rotation, and then they're gonna relax. The next exercise we're gonna do is resistance exercises with hand weights. We're gonna do first for internal rotation. So what we're gonna do is we're gonna tell the patient to lay down on their side with the butt arm down, and we're gonna tell the patient to have their elbow a little bit in front of their body, have the elbow also bent at a 90-degree angle, and the forearm is gonna be resting on the table. Now what you wanna tell them is you wanna tell them to set up the scapula and brace and breathe at all times while they're bringing the arm towards the body, just like this. Very slow and controlled. Remember that they should be maintaining an abdominal brace, and they should be setting the scapula first. We can progress this exercise by having the patient stand up with a standing with a tube and doing the internal rotation, just right here, having the elbow against their side and doing this. And then progress that by having a towel underneath the elbow and doing a full arc. Now also we can progress this one by adding a 45-degree abduction to the arm and also a 90-degree abduction with the tube. Now we're going to do resistance exercise with hand weights for external rotation. So what we're going to do is we're going to tell the patient to lay on their side with the bad arm up. So my right arm is the bad arm. We're going to tell them to have the elbow by their side and it's going to be bent at 90-degree angle. Now you're going to tell the patient to set up the scapula and keep bracing and breathing at all times. Now you want to tell them to hold the weight from across the body and move the arm away from the body until the forearm is in a horizontal position. So we're going to go from here and we're going to go to the horizontal position. We can progress this exercise by moving the arm past horizontal, so increasing the arc. So past horizontal and then coming back. This exercise can also be performed standing with the elbow by their side and then just doing the same thing, external rotation. And we have to have a towel under the elbow, I forgot. And we can progress this by having the arm up, the shoulder abducted at a 45-degree angle and then at a 90-degree angle with a tubing. The next exercise is called forward flexion or full can elevation. So for this exercise, we can do this exercise for forward flexion or in scaption. So if we're going to do forward flexion, we want to tell the patient to set up the scapula, brace and breathe at all times, and we're going to tell them to do forward flexion, but limit the forward flexion to 60 degrees to start, and then come back. And then if we're going to do scaption, we want to make sure that the thumb is facing up, and we do scaption like this. And we're going to limit the scaption also to a 60-degree angle to start. Remember that they have to set up the scapula first and maintain the abdominal brace and breathe at all times. This exercise can also be done stepping on a tubing or a TheraBand with the contralateral leg. So we're doing forward flexion, the palm is down, set up the scapula, brace and breathe. And we're going to limit that to 60 degrees of forward flexion. And if we're going to do scaption, the thumb should be pointing up. And we're going to limit that to 60 degrees as well. And then we relax. Set up the scapula and brace and breathe at all times. The next exercise is called I's, Y's, and T's. So for this exercise, we want to tell the patient to maintain a neutral cervical spine, to keep that abdominal brace and breathe at all times, and to set up the scapula before performing the exercise. So we're going to pretend that this is an exercise or gym ball. We're going to tell the patient to lay over the gym ball. And remember the three things: maintain cervical spine, keeping that abdominal brace, and setting the scap. And we're going to tell them to lift their arms up at the 180 degree. So we're doing an I. This is going to be working the latissimus dorsi. And then they come down and relax. Now they're going to lift the arms up at a 145-degree angle, making a Y, maintaining that bracing and breathing. And we're working the lower traps. And then if they lift it up to 90 degrees, that will be the T. And they will be working the middle traps and the rhomboids. They can progress this exercise by adding hand weights in the three positions: 180, 145, and 90 degrees. The next exercise that we're going to do is called prone 90-90 ball drops with pliable. So this is going to be our pliable. So what we're going to do is we're going to tell the patient to lay prone on the table with the arm, with a towel underneath the shoulder, and the arm at a 90-90 position, horizontal to the floor. So the arm is going to be abducted at 90 degrees elbow is gonna be bent to 90. Then we wanna tell the patient to set up the scapula and brace and breathe at all times. You wanna make sure the patient is in a comfortable position, but they should be able to look at the ball. Then you wanna tell the patient to drop the plyo ball and catching it, using internal rotation and external rotation of the glenohumeral joint. Remember, brace and breathe at all times. That's how it should look like. The next exercise is a diagonal exercise with a tubing or a TheraBand. This exercise is called PNF sword diagonal flexion exercise. So for this exercise, we're going to tell the patient to set up the scapula and keep an abdominal brace before performing the exercise. Then we're gonna do it for the right arm, or the right shoulder. We're gonna tell the patient to stand on the TheraBand on the good shoulder side, and then grab the TheraBand with the bad shoulder, and the palms should be facing back. Then remember that they have to maintain to brace and breathe at all times and set up the scapula. Then we're gonna tell them to do flexion, abduction, and external rotation at the same time, as if they are unsheathing a sword. So it should look something like this. And then they relax, and then they do it on the other side. The next exercise is another diagonal exercise. This exercise is called PNF seatbelt extension exercise. So for this exercise, we want to tell the patient to set up the scapula and brace before performing the exercise. You also want to tell them to have a tubing or a TheraBand hooked on the wall, and it should be above shoulder level, and it should be hooked on the good side. So I'm going to do my right arm, my right shoulder is the bad shoulder, so it should be hooked on my left side. And then you are going to tell the patient to stand with the bad arm at the ending position of the sword exercise. So that means at about 165 to 170 degrees of shoulder abduction, and also with the palm facing forward. Now you want to tell them to, again, set up the scapula and brace and breathe at all times, and then perform extension, adduction, and internal rotation of that right shoulder, all at the same time, as if they are pulling on a seat belt. So the palm should start facing forward, and then it should end facing backwards on the opposite hip. So it should look something like this. And then they will do it with the other side. Remember, maintaining that abdominal brace and breathe, and keeping that scapula set. This exercise is called push-up on Bosu, platform side up. So for this exercise, we want to start by telling the patient to maintain a neutral spine and keep that abdominal brace, and also to set up the scapula and breathe at all times. We want to tell them to start kneeling while holding grips on the platform, and with the chest over the center, elbows straight, and they're going to hold this position for 15 to 30 seconds. After that, they're going to start tilting the platform forward, back, side, and side by leaning the body. And after that, they're going to bend the elbows to lower their body on a push-up position, and then coming back up. We can progress this exercise by having the patient do the same things, but going on their ankles. So right here, we're gonna hold 15 to 30 seconds, maintaining that abdominal brace and breathing. And then we're gonna progress by leaning, tilting the platform. And then we wanna lower the body to a push-up position, keeping that flat, keeping the platform flat or a little bit tilted towards the patient. The next couple of exercises are going to be performed using a body blade, but because I don't have a body blade with me today, we're gonna pretend that this is our body blade. So some of the general instructions that we need to know when we're using a body blade is that we want to make sure we tell the patient that they should check for clearance on each side of the blade, because we don't want the blade to be hitting anything on either side, so this side or this side. Also, you want to tell the patient that they should start doing the exercises or each position for 20 seconds and then progress up to a minute on each position. Then they should maintain that neutral spine, keep the abdominal brace, setting up the scapula, and breathing normal throughout the exercises. Also, you want to tell them that to control the intensity of the exercises, they do it by controlling the degree of deflection, and the deflection is how much the blade is going to go down and how much is going to go up. That's the degree of deflection. So they can control the intensity by controlling how much it goes up and down. And you want to tell them that they should try to make the body blade reach at least 2 feet. So 1 foot down and 1 foot down for a total of 2 feet on each side. They can have a normal stance or they can have a fencer stance, but make sure they always maintain that abdominal brace. So the first hand placement that I'm going to be doing today is a 2-hand with a 90 degree of forward flexion. So for this one, we're going to tell the patient to set up the scapula, brace and breathe, and move the blade up and down, up and down, up and down. This one is going to work the abdominals as well as being a total shoulder workout. The second one is a one hand grip with the shoulder with the arm by the side, and you're going to tell the patient to do the scapular setting, bracing and breathing, and we're gonna move the blade up and down, up and down, up and down, and this is gonna be a total shoulder workout. The third position, it's gonna be right here, so it's a one-hand grip with a 90 degrees of forward flexion, and they're gonna do the scapular setting, brace and breathe, and they're gonna move the blade front and back this time, front and back like this. And this is gonna work. This is also gonna be a total shoulder workout, but it's gonna especially target the long head of the biceps at the shoulder insertion and the anterior deltoid. Now the fourth position, it's gonna be a one-hand grip at a 90 degrees of scaption. You wanna tell them to set up the scapula, brace and breathe, and move the blade front and back, front and back, and front and back. This one is going to be another total shoulder workout, but it's going to especially target the supraspinatus and the anterior deltoid and middle deltoid. The fifth position is going to be a two-hand grip, a two-hand bottom grip. On this one, we want the elbows to be bent, and we are going to do the scapular setting, bracing and breathing, and we're going to move the blade up and down, up and down, up and down. This one is going to the insertion of the biceps at the elbow, so right here, and also it's gonna work the triceps. The last position is gonna be a top bottom position like this. So a two-hand top bottom, and on this one we're gonna be at 90 degrees of forward flexion and do a scapula setting, bracing and breathing, and we're gonna tell the patient to move the blade front and back in the horizontal plane. So as you can see, my hips and my abdomen are also moving. It's hard to isolate this from here. So on this one is gonna work the glute med, the glute max, the abdominals, the obliques, the pectoralis muscles, as well as the anterior deltoid. Now, those were the 5 different positions that we can do, do these exercises using the body blade, but you can progress any of those positions using a stability pad or even sitting on an exercise ball or a gym ball. Okay, now to finish this presentation, I would like to give you guys some ideas of other fun exercises that we can also do with our patients, that they're really gonna enjoy them, and they're gonna be like working all the rotator cuff muscles of the shoulders. So some of those exercises will be push-ups on a wobble board, or rowing with a tubing or a TheraBand while sitting on an exercise ball, or even like catching and tossing a ball with a trampoline. Okay, this concludes my presentation. Thank you for your attention.